So I'm going to introduce our next speaker, who's making his entrance. Nathan Lachowsky completed his PhD of epidemiology at the University of Guelph. He has worked with gay and bisexual men in Canada and New Zealand. His dissertation research focused on HIV prevention for younger men and men of different ethnicities in New Zealand. He continues work in Ontario through the University of Toronto on various community-based research projects, including a provincial study of online outreach services. Now he lives in Vancouver. We're happy of that. And works on the Momentum Health Study as a postdoctoral fellow with the BC Centre for Excellence in HIV and AIDS. Nathan.
Thank you, Shark Olivier. I made a corny joke earlier about not eating me alive, but because of his hat. No? Okay. So I'm here and thinking about Mark's triangle. I think this presentation probably fits a little bit on the side of what Mark was talking about and trying to identify a bit of how users are thinking about and feeling about the information that they're searching for online. And so this project I'm presenting on behalf of collaborators and co-authors from the University of Toronto, along with a litany of community-based partners in Ontario, of which the individuals who represent those agencies are listed here, that comprise our Cruising Counts team. And I'd like to acknowledge our community advisory board members as well, who have helped us throughout this research project design. I think we've talked a lot about this, so I was sort of like, oh, this will be good. I won't have to give too much of a background. But I do think, just briefly, I think we know that gay men are using the internet more and more for a variety of reasons, and that it does provide a level of anonymity and accessibility that is quite different to in-person services and resources. And that I think there's one interesting qualitative study that we found that really helps in terms of trying to think about why online outreach. And we're talking in this presentation mostly about information seeking, but it was that within these sort of chat rooms, the study identified that when guys were lacking basic information about HIV, they had questions about testing, and they felt that the community resources they had available weren't sufficient. So what we wanted to look at were, well, in Ontario, what information are gay men searching for? Where are they getting it from? And how are they thinking and feeling about that information? So some pretty simple, basic questions that we wanted to try and answer. So to do that, we have this community-based partnership of a variety of AIDS service organizations, some public health folks, some government folks, and a few academics. And what we wanted to do was a province-wide study looking at online outreach and online health information within the province. And so there's a qualitative arm that we had 22 interviews that we conducted with service providers within the province, either managers or frontline providers, and then also some interviews with sort of best practices outside of the province to talk about online outreach and barriers and facilitators to that. But I'm going to be talking about the online questionnaire we did, which collected both some quant and qualitative data from guys themselves. So in between what I call the winter holiday period of December 2013 to January, we collected responses from 1,800 guys. And we recruited mainly through online venues, so predominantly Squirt and Grindr, but we also sort of did some targeted recruitment through other apps that were informed by our community partners. And we use social media as well, Facebook and Twitter, through those agencies, their email listservs and whatnot. The survey itself was anonymous, and guys completed it themselves. It took about 15 minutes. And we used Fluid Surveys as a platform for that, particularly because they had a really good mobile platform. And we knew that a lot of guys, based on our recruitment, would be doing this from a tablet or from a mobile phone. In terms of eligibility, we've tried to cast it as broad as we could, so that it was age 16 or higher, really any sexual orientation or practice that falls broadly within gay, bisexual, queer identities, and gender across the board. And in terms of online use, it really was also quite broad. It was sort of, have they ever used it for sex or health, or are interested in doing so? And in terms of geography, we just sort of said you have to currently live or work in Ontario, or have visited here at least 3 times in the past year. And part of this came from the fact that there are some agencies within the province that provide services on borders, either provincial borders or country borders, where guys are crossing that border quite frequently. So we wanted to see if we could catch some of those. In terms of the analysis, I'm really just going to be talking about descriptive statistics today. So it's just counts and percentages. So just nothing too fancy, scary epidemiology there. But I'm quite interested in presenting some of the qualitative analyses that we've been looking at, which are sort of guys' open-ended responses to questions that we ask them about health information seeking. And these are going to be presented in, we've obviously selected quotes, but they're the words of guys. And I do want to sort of put a disclaimer out there that you may not agree with some of the commentary. And I think Mark I'm glad he made the point at the end of his presentation. and that I think some of the language that you'll see in some of these quotes are probably reflective of some of the things that are out there. And for people who do work in online contexts, you'll see that some of the language can be quite strong in ways that I think many of us probably would disagree with. So, in terms of the sample, this is sort of the demographic slide of what we had in terms of responses. So, age 16 to 84, predominantly cis men. Most were Canadian citizens. 3/4 were employed. In terms of sexual orientation, 3/4 identified as gay, 20% as bi. The rest is different sort of queer identities. A few straight guys. In terms of geography, this is probably what we were most happy with. We were a largely Toronto-based team with Toronto-based agencies, but we had partnerships in other parts of the province, and we really wanted to try and get responses from guys that were in other parts of the province, not just our major sort of Toronto urban center, and not just London and Ottawa and whatnot. And so we had 30% of the guys from Toronto, and the northern part of Canada, or Ontario, had 7%, and then in between those two percentages were every other region of Ontario. In terms of HIV status, 8% self-identified as HIV positive, 12% said they were unsure of their status, the remaining saying they were negative. And in terms of race and ethnicity, this was our breakdown by that demographic factor. This sort of census data for Ontario says about 71, 72% are white Caucasian. So we're oversampled there, which is a common sort of finding in online research. We often find the white gay men. And so we had a lot of community partners, and we tried our best to do targeted enrollment. And so we're happy with sort of our distribution in some regards, but of course it's still limiting in terms of what we can say and do. So that's an ongoing struggle. So these were the top 15 most frequently used social sexual sites or apps. You can see up there which ones maybe are your favorite and whether you agree or disagree. Guys could of course report more than one of these, and we're trying to think a little bit about how many different sort of sites or apps guys are on, and where we can sort of think about what might be the better sites or apps in terms of their technological capabilities and in terms of sort of their culture within those sites or apps to do some of this work in outreach. And we recruited mainly from Grindr and Squirt, so I mean that probably skews a little bit about why they're the most popular. In terms of why guys are going online, I mean, the predominant reasons you can see at the top there are sort of related to sexual, social things. 2/3 said to escape or be distracted. And I think sort of the ones that I bolded here are the ones more around information seeking. So do you mean to get info about sex, about testing, so on and so forth. In terms of what they're using, guys reported basically personal and work devices across the board. I mean, predominantly they're looking for information on their personal devices. But I mean, a large proportion of guys are on mobile devices, and I think that's a basic question we need to ask ourselves in terms of these sites. Are they mobile friendly? Can guys look at it while they're on the bus, while they're in transit, so on and so forth? And guys said on average they spend about 1 hour, with some guys saying up to 95 hours a week they're looking for sexual health info. Just consumers of knowledge. Some did say none as well. We also asked guys, do you feel like you have privacy online, that you would be able to look at sort of things? And most guys sort of here you can see are saying, more than half are saying often or always they do. But there is a group of guys up here, a small percentage, that don't feel like they do. And I think that's an important piece that we need to look at more too. So in terms of have they ever looked for sexual health info online, 92% of the guys said yes. Most of them said it's sort of, half of them said about a few times a year they're looking for it. And about a quarter said that they look for it when they need it, or so when they might have symptoms of some STI. In terms of how they found the information, most are finding it themselves, okay? But some are getting it sort of through banners, like banner apps or advertisements, campaigns that might be on a website or on an app. And some people are getting it through contact with an online outreach worker, either being contacted actively or seeking out contact with that person. In terms of what they were looking for, in terms of sexual health topics, and again, they can choose more than one here, you can sort of see the list here. I think what's really interesting generally is that we could argue that maybe these do have to do with sex and sexual health, but the majority of these are about relationships, okay? And then you can sort of see this list goes on to different things. And particularly, I mean, these are sort of the new age, I guess if we want to talk sort of modern developments, are not a lot of guys said that they were looking for this information. So now we're going to get to some of the quotes, and I don't have time to read all of these, so I'll let you read while you listen, or just read while you don't listen. It's up to you. But what we sort of tried to do was group guys' responses to this question of what types of information would you like to see more readily online? So this first sort of grouping, and it's not by priority, it's just sort of the groups as we presented them, is looking about viral loads, undetectability, and risk, and sort of having positive sex. I'll read the second quote here. So that being HIV positive does not mean that you can't have sex. That an undetectable viral load means your chances of transmitting the virus are next to 0 when using a condom. So these are what guys responded to that question. There's also a lot of responses around risk profiles specific to various sex practices and genders. I think that second quote there really speaks to what Mark was talking about in terms of this sort of chart that sort of outlines the different behaviors and the exact risk that goes with them, and sort of that very tabular format of thinking about these. So you can see that guy talking about the chance of getting HIV by giving and receiving oral without a condom, with and without taking cum in the mouth, and with and without swallowing cum, which, I mean, I don't think we have reliable numbers on to do, but it sort of speaks to the way the guys are thinking about these things. They also were thinking a lot of, or commenting a lot about myths and facts, and wanting to like sort of be set straight in terms of what is reliable and what is true and what's not. And so these first sort of two quotes here, I'll read through. So debunking some of the myths surrounding STIs. The sexual environment is too preoccupied with paranoia, and everyone is suspect. It's not a healthy environment at all. And then another guy reporting, information on HIV-positive men and detectable or undetectable viral loads. Too many men online are claiming this is true to unsuspecting people. So some interesting sort of commentaries and thoughts there in terms of how people are perceiving themselves, perceiving others, perceiving these sort of this online milieu. A lot of comments about sort of testing and HIV testing, getting these services, access to these services, what to expect in terms of going through testing. So this, I'll read this one in the middle. I think websites that talk about HIV should be more honest about the 3-month window period, or how that window works. The majority of people seroconvert within the first 6 weeks after exposure, so testing at 6 weeks can have value if you feel you may have been exposed, but most websites just say you have to wait 3 months, causing most guys to suffer for a full 3 months before they can have any sort of reassurance. So I mean, I think that's speaking to this sort of guy's process around how he understands it, what he's seeing in terms of the information, and I think a little bit of frustration, I guess, in terms of disconnect between those. A lot of guys talked about wanting positive, affirming information and interactions. And I mean, you can see just based on some of the quotes why there's a desire for that sort of that value to be through through the commentary that's being provided. So info that focuses on harm reduction rather than shaming people who don't use condoms, that really only makes it worse. If using condoms was easy or an option, I would not be looking for information about minimizing risk in bareback sex. Also commentary about HIV criminalization and disclosure. So there's a few quotes that are provided there. I'm not sure how I'm doing. How am I doing time-wise? Oh, okay, I'm doing okay. Okay, so that was sort of the main groupings of qualitative feedback that guys gave in terms of what information they're looking for. In terms of where they looked for information, and we're still looking at this is sort of the general quantitative feedback, is that 2/3 of guys are finding it through an online search engine. And I think for service providers and people who are working on campaigns in the room, that is the predominant and, I mean, almost in some ways near exclusive way that people are looking for this. I think a quarter of guys said they went to public health or government websites or community agency websites, which is good, but I think we really need to be making sure that we're clear in terms of how are our sites and our services and our campaigns coming up on search optimization, if people are familiar with that. And I mean, in a small proportion of guys are reporting some of these sort of other areas. And we didn't really know what to expect when we're asking this question. And one of the things we have done is ask them, well, what search engines are you using? I mean, predominantly, that's not so surprising. But we are going to have some qualitative information looking at what public health and government websites and what community websites and whatnot. So we can start doing some linkage in terms of some of the next steps, which is how do they feel about it? And I'll get to that data in a second. So they also provided some feedback on what online resources they would like to see more of or more information included on. And I mean, it'd be interesting a little bit to pull the room in terms of thinking about this. We sort of were expecting that guys would say they want it in a certain place and like leave the sex where the sex is happening and like do your work over there and we'll go get it when we want it, but otherwise don't be in our face. And certainly guys said that, but there was also a lot of guys that were like, put it there because that's where I am and that's where I want the information. And so basically what guys said was they would like us to have the information everywhere. So there's a lot of money there in terms of trying to provide advertisements on all of those platforms all of the time, but that's sort of what guys put forward. So how did guys feel and think about the information they had received? And so we asked guys about the last time they had looked for information. Did you find what you were looking for? 80% of them said yes, which is good. In terms of evaluating that, this is sort of what guys were saying. This sort of first set of them are sort of negative evaluations of the information. So some, 15% said it didn't fully answer their question. Some said it didn't apply to them or seem up to date, or that it was confusing. 7% of guys said it made me feel bad about myself. And we can do a little bit of linkage in terms of trying to understand what sites or where that information was coming from. Again, sort of too technical with 6%. But half of guys said that there was no problems with the information they received. They liked it. In terms of how reliable they felt the information was, this is sort of all the responses. The top two bars here show very reliable. So this is on a 5-point scale from very unreliable to very reliable. So that 2/3 of guys are saying generally that they felt it was reliable, which is good. Thank you. And so we asked guys sort of what are the key sort of features of valuable online sexual health resources, information, and websites. And what we would summarize that qualitative feedback from guys is that they want it to be accessible, comprehensive, and relevant to them. They'd like it to be confidential and anonymous, and they want to have safe access to service providers and resources. This other feedback is somewhat related to online outreach as well, but they want access to service providers in real time, 24 hours a day, and be able to ask questions and interact with them. They'd like links to additional health sites and government resources and forums, and I think this is an important piece in terms of how we think we do the work, in that those cross-linkages guys are looking at. You know what I mean? It's sort of when we think about academic referencing or whatnot, they sort of want to see where they're getting the information. But I think if we can think about what sites we link to and sort of provide additional credibility to by linking to, or commenting, perhaps saying, here's a resource that we don't think is great or that is out of date, blah, blah, blah. I mean, that can be work that we can try and think about doing as well. They want things that are scientifically supported, and they want citations and links. And they would like information on testing resources, procedures, and contact information. And they'd like it to be available across a variety of platforms and work across a variety of platforms. So, in summary, guys are going online often and they are searching for sexual health information. We're not just there to have sex. And most guys feel that they can have private conversations online, and most are interested in information on dating and relationships. That's sort of what the predominant thing is that they were looking for. And they desire earnest, sex-positive, stigma-free resources. And most are using internet search engines, and I think we need to think about that in terms of how we're providing information. And many guys are satisfied with the information they're feeling and feel quite reliable about it. So with that, I'd like to thank you for listening, for the opportunity to speak at the summit, and our funders, the Ontario HIV Treatment Network, which provided the funds for this project. Thank you.